I need to tell you something that could literally save your life tonight. Right now, someone you know is taking a medication that could kill them if they have just one drink. And the scary part? They probably have no idea. Every single day, thousands of people end up in emergency rooms because they mixed alcohol with the wrong medication. Some never make it out. This isn't about being dramatic. This is about understanding that your medicine cabinet might contain a ticking time bomb. What makes this even more terrifying is that many of these dangerous combinations involve medications you probably think are completely harmless. Over-the-counter pain relievers, allergy medicines, even common antibiotics. Mix them with alcohol and you're playing Russian roulette with your health. Let's start with the most common and most dangerous combination: pain medications and alcohol. If you've ever taken ibuprofen or acetaminophen after a night of drinking, you need to hear this. Acetaminophen, the active ingredient in Tylenol, is one of the most widely used pain relievers in the world. Millions of people take it every single day without a second thought. But here's what most people don't know. Your liver processes both acetaminophen and alcohol using the same enzymes. When you drink alcohol, your liver gets busy breaking it down. If you take acetaminophen at the same time, your liver can't handle both jobs efficiently. The acetaminophen builds up to toxic levels. This can cause severe liver damage or complete liver failure. And we're not talking about years of abuse here. Even a single dose of acetaminophen with moderate drinking can start this process. The damage can happen so fast that you won't even realize it until it's too late. Your liver starts failing. Your skin turns yellow. You feel confused and disoriented. By the time you get to the hospital, the damage might be irreversible. You could need a liver transplant just to survive. But acetaminophen isn't the only pain medication you need to worry about. Ibuprofen and other NSAIDs like naproxen create a different, but equally dangerous problem when mixed with alcohol. Both alcohol and NSAIDs irritate your stomach lining. Take them together and you're basically setting yourself up for internal bleeding. Your stomach lining gets so damaged that it starts bleeding. Sometimes this bleeding is slow and you don't notice it right away. Other times it's sudden and severe. People have ended up vomiting blood. They've had black tarry stools indicating serious internal bleeding. Some have needed emergency surgery. All because they thought taking a couple of ibuprofen after drinking was no big deal. Now let's talk about something even more serious. Prescription painkillers and alcohol. If you're taking opioids like oxycodone, hydrocodone, or codeine, mixing them with alcohol can stop you from breathing. Both opioids and alcohol slow down your central nervous system. They make your breathing slower and shallower. When you combine them, this effect multiplies. Your breathing can slow down so much that it simply stops. You fall asleep and never wake up. This is how countless people have died from accidental overdoses. They weren't trying to hurt themselves. They just didn't understand how dangerous this combination really is. They had a few drinks, took their prescribed pain medication, went to sleep, and their body forgot to breathe. Moving on to another incredibly common and dangerous combination: antibiotics and alcohol. You've probably heard that you shouldn't drink while taking antibiotics, but do you know why? Certain antibiotics like metronidazole and tinidazole cause a severe reaction when mixed with alcohol. This reaction is called a disulfiram reaction, and it's absolutely miserable. Within minutes of drinking, you'll experience intense nausea and vomiting. Your face turns bright red and feels like it's burning. Your heart races. You get severe headaches. Your blood pressure can drop dangerously low. This reaction can last for hours and in severe cases can lead to heart problems and breathing difficulties. Some people have ended up hospitalized because they had just one drink while taking these antibiotics. Even antibiotics that don't cause this specific reaction can still be dangerous with alcohol. Alcohol weakens your immune system and makes it harder for the antibiotics to do their job. You're basically sabotaging your own treatment and giving the infection more time to get worse. Let's talk about something millions of people take every day. Antidepressants and anti-anxiety medications. These are some of the most prescribed medications in the world, and mixing them with alcohol is playing with fire. Selective serotonin reuptake inhibitors, or SSRIs, are the most common type of antidepressant. Medications like Prozac, Zoloft, and Lexapro fall into this category. When you mix these with alcohol, several dangerous things can happen. First, alcohol is a depressant. It works against what your antidepressant is trying to do. You're literally counteracting your treatment. Second, both alcohol and SSRIs affect your brain chemistry. Together they can cause extreme drowsiness, impaired judgment, and dangerous mood swings. Some people have experienced severe depression or even suicidal thoughts when mixing these substances. But SSRIs aren't even the most dangerous antidepressants to mix with alcohol. Older antidepressants called MAOIs, like phenelzine and tranylcypromine, can cause a life-threatening spike in blood pressure when combined with alcohol. Your blood pressure can shoot up so high that you have a stroke or heart attack. Anti-anxiety medications like Xanax, Valium, and Ativan are even more dangerous with alcohol. Both benzodiazepines and alcohol slow down your central nervous system. Mix them and you're looking at extreme sedation, respiratory depression, and possible coma or death. People think they can have just one drink and be fine. But that one drink hits differently when you're on these medications. You black out. You can't remember what happened. You lose coordination and fall, causing serious injuries. Or worse, your breathing slows down so much that you stop breathing entirely. Now here's something that catches people off guard. Cold and allergy medications mixed with alcohol. These seem so harmless that people don't even think twice about it. Many cold medicines contain ingredients that don't mix well with alcohol. Antihistamines like diphenhydramine, found in Benadryl and many nighttime cold medicines, cause drowsiness. Add alcohol and this drowsiness becomes dangerous sedation. People have gotten behind the wheel thinking they were fine and caused fatal accidents. Cold medicines that contain dextromethorphan, a common cough suppressant, are particularly dangerous with alcohol. This combination can cause dizziness, drowsiness, impaired motor control, and in high doses, dangerous changes in heart rhythm. Some cold medicines also contain acetaminophen, which, as we discussed earlier, is terrible for your liver when mixed with alcohol. You might not even realize your cold medicine contains it because you're not thinking about it. Let's discuss blood pressure medications and alcohol. If you're taking medication to control your blood pressure, drinking alcohol is a serious gamble. Alcohol can cause your blood pressure to drop too low, especially when combined with blood pressure medications. This can lead to dizziness, fainting, and falls that result in serious injuries. Older adults are particularly vulnerable to this. Some blood pressure medications can also become less effective when you drink alcohol. Your blood pressure goes up instead of staying controlled. Over time, this increases your risk of heart attack and stroke. Diabetes medications present another serious danger when mixed with alcohol. If you're taking insulin or oral diabetes medications like metformin or glyburide, alcohol can cause your blood sugar to drop dangerously low. This condition, called hypoglycemia, can make you feel dizzy, confused, and weak. In severe cases, you can have seizures, lose consciousness, or even die. The tricky part is that the symptoms of low blood sugar and being drunk are very similar. People around you might think you're just intoxicated when actually you're having a medical emergency. Alcohol also affects your liver's ability to regulate blood sugar. Your liver normally releases glucose into your bloodstream to keep your blood sugar stable. But when your liver is busy processing alcohol, it can't do this job properly. Your blood sugar drops and stays low. Here's something most people never consider: heartburn medications and alcohol. Medications like ranitidine and famotidine that reduce stomach acid can actually increase alcohol absorption. This means you get drunk faster and the alcohol stays in your system longer. You think you're having a normal amount to drink, but you end up much more intoxicated than expected. Sleeping pills and alcohol are another deadly combination. Medications like Ambien, Lunesta, and even over-the-counter sleep aids like Unisom work by slowing down brain activity. Alcohol does the same thing. Together they can cause severe respiratory depression, dangerous sleepwalking behaviors, and memory blackouts. People have driven cars, cooked meals, and done all sorts of dangerous activities while in a sleep state caused by this combination. They have no memory of it afterwards. Some have seriously injured themselves or others. So what should you do with all this information? First, read the labels on every medication you take. Look for warnings about alcohol. If you're not sure, ask your pharmacist. They can tell you specifically about your medications. Second, be honest with your doctor about your drinking habits. They need to know so they can prescribe medications that are safe for you. Don't be embarrassed. Your doctor has heard it all before and they're not there to judge you. Third, if you're taking any medication regularly, consider avoiding alcohol altogether. I know that's not what you want to hear, but it's the safest option. If you do choose to drink, wait at least several hours after taking your medication. Better yet, skip your medication that day and take it the next morning when the alcohol is completely out of your system. Fourth, never take medication to try to prevent or cure a hangover while you're still drinking or immediately after. This is when your liver is most vulnerable and when dangerous interactions are most likely to occur. The bottom line is this: mixing medications with alcohol is never worth the risk. The consequences can range from making your medication less effective to causing permanent organ damage to sudden death. Your health and your life are too valuable to gamble with. If you found this information helpful, share it with someone who needs to hear it. You might literally save a life. Stay safe out there and make smart choices about your health.